Chemotherapy. Overview. Chemotherapy is a drug treatment in which powerful chemicals are used to kill fast-growing cells in the body. Chemotherapy is often used to treat cancer, where cancer cells grow and multiply much faster than other cells in the body. Many different chemotherapy drugs are available. Chemotherapy drugs alone or other drugs can be used to treat a different range of cancers. Although chemotherapy is an effective method for treating many cancers, it also involves risks for side effects. Some side effects of chemotherapy are minor and treatable, while some may cause serious complications. Why is this done? Chemotherapy is used to kill cancer cells in people with cancer. There are many cases in which chemotherapy can be used to treat people with cancer. To treat cancer without other treatments. Chemotherapy can be used as a primary or single treatment for cancer. After other treatments, to kill hidden cancer cells. Chemotherapy after other treatments may be used as surgery to kill any cancer cells that may remain in the body. Doctors call this an adjunct therapy. To prepare for other treatments. Chemotherapy can be used to reduce the size of the tumor to allow other treatments such as radiation therapy and surgery. Doctors call this an adjunct therapy in principle. To relieve the signs and symptoms of the disease. Chemotherapy is used to relieve the signs and symptoms of cancer by killing some cancer cells. Doctors call this a palliative chemotherapy. Chemotherapy for non-cancer cases. Some chemotherapy drugs have proven useful in treating other conditions, such as bone marrow diseases. Diseases of bone marrow and blood cells can be treated through bone marrow transplantation, also known as stem cell transplantation. Chemotherapy is often used to prepare for a bone marrow transplant. Immune system disorders. Low doses of chemotherapy drugs can help control overactivity of the immune system in some diseases, such as lupus and rheumatoid arthritis. Risk. Side effects of drugs can be significant. Each drug has different side effects and each drug does not cause a side effect. Ask your doctor about the side effects of some of the drugs you will take. Side effects during chemotherapy. Common side effects of chemotherapy medications include nausea, vomiting, diarrhea, hair loss, anorexia, fatigue, fever, mouth ulcers, pain, constipation, easy bruising, bleeding. Many of these side effects can be prevented or treated. Most side effects subside after treatment. Long-term subsequent side effects. Chemotherapy medications can also cause side effects that appear only after months or years of treatment. Delayed side effects vary depending on the chemotherapy drug, but may include damage to lung tissue, heart problems, infertility, kidney problems, nerve damage, neuropathy, risk of another cancer. Ask your doctor if there is a possibility of any late side effects. Ask him what signs and symptoms you should be aware of that may indicate a problem. How to prepare. The method of preparation for chemotherapy depends on the types of medications you will take and the way you will receive them. Your doctor will give you specific instructions to prepare for chemotherapy procedures. You may need: insert a device through surgery before starting intravenous chemotherapy. If you're going to receive intravenous chemotherapy, your doctor may recommend implanting a device such as a catheter, a gate catheter or pump. Catheters or any other device are implanted in a large vein, often in the chest, through surgery. Chemotherapy drugs can be received through this device. Undergo a range of tests and procedures to make sure your body is ready for chemotherapy. Blood tests to ensure the safety of kidney and liver function, and heart tests aimed at checking heart health can determine whether your body is ready to start chemotherapy. If there is any problem, your doctor may delay treatment or prescribe another medication and a different dose so that chemotherapy is safer for you. Visit the dentist. Your doctor may recommend visiting your dentist to examine your teeth for any signs of infection. The incidence of existing infections helps reduce the risk of complications during chemotherapy, as some chemotherapy methods may reduce the body's ability to resist infection. Develop a plan to deal with side effects. Ask your doctor about the expected side effects during and after chemotherapy, and make appropriate arrangements. For example, if chemotherapy is going to cause infertility, you might want to consider options for keeping sperm or eggs for future use. If it will cause hair loss, you may consider wearing the headscarf. Arrange for assistance at home and at work. Most chemotherapy drugs are received by patients in outpatient clinics, which means that most people will be able to continue their work and carry out their usual activities during the chemotherapy period. Your doctor can tell you how chemotherapy affects your usual activities in general, but it will be difficult to predict exactly how you feel then. Ask medicine. We have reached the end of the video. If you have any idea for the upcoming videos, or criticism for the development of the content, do not skimp on me and write it in a comment, and I will be thankful to you.